the screen.
Why is it looking Yeah, why is it looking over there?
Didn't work.
Am I up on the screen?
Yeah.
Just do a headless, that's fine. This angle.
I
just want this angle.
Am I on the screen? You don't want to look at me.
Huh.
What do you want?
I think just audio, I guess, listening. Not hearing them. There they are. They're talking.
What? Hmm.
Yeah, that is true.
I'm okay, guys. I can hear you all right.
Yeah.
Thanks to Mrs. Turner. Don't look at me. Am I on the screen? Get that off.
You're not on the big screen, you're on a little one.
Put something on the. Okay.
Where's your flippers?
Well, I figure about every 3 days, doctor, when you're retired, you can do that. I had a beach walk this morning watching manatees float by. That's how I started my day. So I'm pretty mellow, so you guys do whatever you want to do.
I'll try to get.
Go ahead and start.
Go ahead and call the meeting to order. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yep. Dr. Amber, Jeff DePass.
Present.
Dr. Lim. Mark Collins.
Present.
It's like got normal tracking.
Present.
James Turner, Dr. Turner.
Yeah, but it stayed right where it is.
Dr.
Where's that?
Jennifer Todd. Dr. Brecken.
Oh shit! Forgot there's a remote.
Everybody's here. Let me see, do you have an action item for the last minutes?
Which-
Just approved, yes, that's correct. Did everyone get a chance to look at the minutes?
The remote's not working.
Any concerns or
And
changes?
hey. Yep. Mm-hmm. Yep.
All those in favor? Right, minutes are approved. All right, Robin.
There it is. There it is. There it is. I got it. Yeah.
Made my very first chart of accounts on there from January to March. So you listed there, if you have any questions about it. Also, Joni wants to, there's a couple things that's not added on here that Joni wanted to touch on.
Yeah, we've been doing housekeeping with our accounts. We realized that we had a checking, we knew we had a checking account, which, as Chelsea knows, is where when we get vaccine reimbursement it goes into. And so we asked the auditor's office today how they would like us to, where do they want us to deposit it, which fund? And it's going to be deposited into the general health fund. So that's the only thing that has not been reflected in the past that's on here. Since we last met, the council approved for our trust fund to be appropriated to Chances for Youth's program that they're doing that's partially funded out of HFI. And part of that will also be funded by health maintenance. And that's really about it. That was pretty much the cleanup as far as looking at the chart of accounts. And we spent down 239,000+ on HFI this first quarter. Robin's been working with the auditor's office to simplify the accounts and making sure that they're accurate.
You're welcome.
Alright, any concerns about the commissioner report? Okay, Dr. Buchan?
I don't have a whole lot to report, just the usual, everyday interactions with nursing and trying to generally work on our sideline PhDs and HFI.
Yes.
And all of those interests. So, some help from that has been- Outside of that, nothing special to report.
Jen?
I've been super busy. I needed 2 of me this last quarter. But again, working with Amanda Fuller and Robin in the auditor's office, that's moving right along. I'm gonna let the social services supervisor, Molly, touch on what we've been doing with the judges, public defenders, commissioner council, community corrections. Something cool that Shelby and I got to do is that we were asked to present at the State House along with a partnership we have with the local hospitals. So Hisham and Shelby and I got to present on the Healthy Start program at Union Hospital, and that was quite the honor because we were the only health department that was asked to present a program. And we did that in February. Just getting in our immunization grant applications. Lots of networking, but majority of the work has gone towards Health First Indiana. I think that most administrators in the state of Indiana have realized it's like taking on a second job.
Yeah.
And it has just been a beast, and that's what I expected the first year, and hopefully next year won't. I know next year won't be as difficult. If you have any questions, especially about number 21,
Well, who won?
Cheryl did. She isn't here, I don't think. Yeah, there she is. She won the pool. She won the basketball pool, and we had an epic hearing.
Right.
And I think that taxpayers are probably challenged in getting their money's worth out of us that Friday.
Well, congratulations. Thank you. All right. Thank you, Jenny.
Thanks.
All right. So no new business today so far. All right, so Amanda, we had you talking about proposed updated fees and ordinances.
They went in front of the commissioners and they passed them, so we implemented them and everything's going good.
Alright. And that's for the proposed fees and then the,
For both, yes.
okay, and then the body ordinance?
Both of them had to go in front of the commissioners to be voted on
Great.
and updated, and we've actually just got our first temporary under the 500-hour rule, so.
All right, program updates, Molly, social services.
You guys stay here.
So since our last meeting, Sean has been certified to teach MRT. MRT is moral recognition therapy. It promotes moral reasoning, better decision-making, and improvement of behavior. It is based on the idea that risky and criminal behavior stems from faulty thinking patterns, such as a lack of empathy, distorted perceptions of right and wrong, and impulsivity. And so we are teaching MRT inside the Vigo County Jail, as well as at community corrections. And we are also teaching relapse prevention and doing peer coaching inside the jail as well, and outside of the jail. The number of individual peers that have been seen since we've started this program for January, February, and March is 72. The number of individuals that we've been able to get enrolled into insurance is 20. Relapse prevention completions, 42. and we've had 3 graduate from MRT so far. And the number of total participants in the MRT program is 113. The number of total participants in the relapse prevention program is 123. And I have added in there that we had, a total of 7 participants who stopped attending class, which is a pretty low number, really, out of as many as started. And then we had 10 that were released, and then 9 were transferred to other facilities. We've had meetings with the Vigo County Sheriff, jail commander, jail matron, Vigo County social worker, public defender's office, community corrections, Vigo County chief prosecutor, the Vigo County attorney, and Valley professionals about how to better serve this population that we are helping. There is a Vivitrol program that I'm working on, wanting to implement into the jail to get them. Do you guys all know what Vivitrol is? So it is an antagonist. So for individuals who struggle with opioid use disorder and alcohol abuse, they can receive the shot, and then for 30 days, it lessens their amount of cravings as well as blocks the receptors for them to get high or drunk. And so if they get the shot in jail, we can set them up with an appointment within the 30 days of their release, and then they'll have a primary care provider, set in place following that. So we're trying to get the funding for 20 individuals to be able to do that, and then follow them at least for a year after. Some of the events that we have attended are the Circles of Change Community in Action Conference. There was a lot of good speakers there, and a lot of good things that Casey, the Chances for Services and Youth, is wanting to bring to this county. The DEC Alliance is really cool. It focuses on the kids and the trauma at that. They focus on the kids because that's where the trauma starts, and then so hopefully they can engage with them, and then it doesn't go into their adulthood.
That's a program we help through Healthy First Indiana currently.
And something else I've added in here is that me and Shauna are going to attend the All Rise Conference in Anaheim, California. And it's a pretty big deal. All Rise is an organization that works across the United States and its territories, as well as in countries around the world. Formerly known as the National Association of Drug Court Professionals, it has been a leader in treatment court movement for nearly 30 years. And their mission is to promote justice system innovation and addressing substance use and mental health disorders. They focus on justice reform, treatment recovery, treatment courts, and equity and inclusion. And me and Shauna, we work directly with the prosecutor's office, the judges, the public defenders, to get these people to where they need to be. I just got my first one who's getting released, who I'll be following closely for the next year to track his progress and to keep him moving in the right direction and keep him supported, because this gentleman has no support. And that's our goal, right? Because a lot of them who are leaving jail don't have any support. And so we're here to kind of fill in that gap for them for whatever they need.
Insurance.
And I have connected with an insurance navigator. So I'm able to go into the jail and have them sign a release and an application for insurance. And so I have them fill those out and then give them to her. She runs them. And then as soon as they get released, these individuals will have insurance to be able to get into their doctor. And so that's been pretty exciting too, because that's a huge,
So if they're in jail, they cannot get health insurance from Medicaid or Medicare?
They can get it, so they can sign up. And what happens is they sign up, it gets suspended for the time being, and then I contact her when they're getting released and it gets reactivated. But yes, they can sign up. Yeah. We've had 20 so far that we've gotten insurance. The key thing there is, when they get released, is getting in contact with her to unsuspend it because it is suspended while they're in jail or incarcerated.
So wards of the state.
Yeah.
The best thing if they are drug addict is teach them or rehabilitate them inside the jail because they have full attention,
Absolutely.
And insurance should pay for those things,
I
If they're
agree.
an outpatient,
Yeah.
We've identified.
Joni, can you hear me?
Yes.
I've had some experience with Vivitrol. I think that's what they were talking about, and Mark knows about it more than any of us, being a pharmacist. But I found it to be an effective medication, but it was very, very expensive. Maybe Mark knows more now if it's come down, but it was like $600 a shot. And so systems would not. It just fell apart as soon as you got it started. So I don't know if something's changed or there's some funding at it, and then sometimes people drift away, but it's pretty easy, one-time shot, show up. But I don't know if Mark knows if it's gotten any cheaper or people using it anymore or not.
No, it definitely hasn't gotten any cheaper.
It's still very expensive.
Yeah,
Okay, well,
I
that's,
don't know if there's grant funding to be able to demonstrate that there's a ROI on it or not. I don't know.
I think it's been successful with some people, but that, sound like that major barrier has not been removed.
If you want to go up against Big Pharma, by all means.
Is it covered by like the Medicaid and HIF?
I'm not sure exactly what the numbers are, but yes, some of it. Yeah.
Some insurance companies cover it, so we use it extensively.
There's also a program that the Wabash Valley Recovery Center has where they have a person who comes there once a month and gives those shots once a month. And so that's another option. So if the insurance won't pay for it and they can't cover it, we were looking into, that being something we could do potentially. And we have a meeting coming up here at the end of May. And we're also, I didn't mention this yet, but we're also going to add another peer recovery coach. So we can widen our,
July 1.
yeah.
And then come January 1 of next year, intake coordinator.
Yes, and so the intake coordinator would be somebody who would be specific to when somebody gets booked into the jail, and I mean like everybody. So it'll be all across the board. So they'll go in there in the morning, have that list of people who were booked into the jail, and we'll have an intake process identifying all their needs. So like, were they homeless? Do they have insurance or not? What their support system looks like, and anything else that they're struggling with, that mental health stuff. It'll identify that so we can better serve them.
How many realistically can you follow once they leave jail? You said you started with one.
Right.
Good question.
It is a good question. So, just based on my own personal experience, working at the prison and working at the recovery center, I had 39 patients is what we call them at Rockville, that I had to meet with and follow, every month. And so there's 3 of us. So I guess potentially 100 we could, but we would be working our tail off, but I think that it's possible, and it looks like this too. So he's going to get out and go to work release. And so he's still got some other support over here. So I'll be meeting with him, whether that's on the phone or in person, once a week until I feel like he's strong enough. Then we'll go to 2 weeks. And so it'll be staggered a little bit. And so it won't be like we're going to have 100 people leaving jail and we got to follow those 100 like the same every week. It'll be tapered down. You know what I mean? And so that'll make it a little easier. I'm not sure exactly what that looks like yet, but we're going to do everything we can to make sure that they're supported, and adding a peer recovery coach is going to help tremendously. So,
do you have endpoint when you're doing rehab? I'm a drug addict. I'm in jail. I've encountered with you. I took your program.
Mm-hmm.
Does anybody follow me up when I go to the community, whether I am, did I go back to drugs or I'm
Yes.
completely? Do you have guys that follow up?
Yes. Yeah.
It'd be
So
nice if you can show that out of 100 that we treated 99% in that, and so it's very successful. That's where you get funding from the
Yes.
state,
Yeah, so we're planning on tracking all that. And that's part of that, keeping in contact with them so actually, the guy that's getting released, this week, I'd actually asked him if he would be willing to come to this meeting next year. The first one of the year after his successful year and just talk about what this program did for him. So that's the plan. So you guys can, see it in action too, but we will definitely be keeping track of the ones who have left and
So who's funding this program now? The Board of Health funding this program right now,
yes.
in-house?
We are.
Mhm.
And then in the first week of May, Molly and I get to go to federal court and tell federal judge Jane Magnus Stinson what programming we're doing as the health department in the county jail because of the overcrowding situation and the ACLU lawsuits.
I think if you look at the Veterans Court model, which sounds similar to this, they've had a great reduction in recidivism and reoffending by doing a similar type model. So I'm hopeful that they're.
And we've identified some veterans in this program who we've been able to get into that. Is why they weren't, I don't know, but we work close with Virgil Mackey and he's, he meets with them and then, they get referred over. But yeah, there's a lot of things.
Who takes care of the mental health component? I know you're on the drug side, but.
There's a mental health clinician inside the jail. She works for a company called Quality 360. And so she's in the jail already. And so we just came in to support, teach the classes and kind of be on the other side of it, the addiction side, I guess is what I'm trying to say.
And remember, at the same time, the courts and the public defender's office have a program also that we're funding, Health First Indiana, that has their approach from the judicial side and public defender side. So we have the approach going with Chances for Youth, the school corporation, and family court, which is Judge Reddy's court, working with the kids. And then we have Molly and Shauna working with the offenders that are in jail. And then the judges and public defender's office and prosecutors are working with those that are currently in the judicial system to try to get them to not reoffend.
It's a lot more than we've ever had.
Absolutely. It's exciting.
It is, yeah.
Yeah, it definitely can help somebody to come back to do the same thing before you have.
Yeah.
Person.
I just want to commend you both because you have really hit the ground running and your numbers are fantastic. And I've seen you all around the community, so I know you're out there
Thank you.
and reaching people.
And the collaboration.
Yeah.
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 It's the only way to be done.
Some people don't stood up.
I know.
So, yeah.
We're working on that though. I think that, it'll all fall into place as far as yeah. I've been really excited. It's been really neat to be able to do this.
Thank you.
I don't have a lot to report, but we've been busy still with birth and death. Brooke is going to attend the spring conference in Fisher, Indiana on Friday. We do have a new part-time person now. Her name is Maddie. It is Molly's daughter. She's doing very well. We do have a full-time position that we have been doing interviews for, that we are hoping to get that fulfilled with the right person. That's really all we have as of right now. And do you guys have any questions?
Thank you for those reports.
And we do want to see you after the meeting to talk about some stuff. And Dr. Brooke wants to see you too after the meeting and talk to you about something.
It's not ominous.
You guys have any questions?
I see you added more information.
Yeah, and it's probably going to be like that as time goes on. I'll take some stuff off and add some more stuff. Okay? Thank you guys.
Environmental?
Okay, so looking at my report, I did a comparison of last first quarter, so 2023, the first quarter to first quarter of 2024, just so you can kind of see where our numbers are at. And I plan on doing that throughout the year, comparing quarter to quarter. If you want to see it some differently, let me know. As far as our programs, we're going into our busy season. So with the weather permitting, septic's hitting the ground running, getting them installs going and repairs, food's starting to kick off with fairs and festivals. Just keeping up. Swimming pools are going to be opening up soon. Just going from there. We've met with the state, regional people on, they're trying to get together because of the new HFI funding, a lead course put together, and there has to be at least, 6 attendees? And we have 3 more that we're going to have send to be lead risk assessors. So that'll be coming in late July. And then they're getting ready to adopt the model food code, FDA model food code. And that'll be coming in July also. So some big changes coming our way. And when I know a little bit more, we'll let you guys know some of the changes, but it's going to completely change the way we do inspections. Yeah, so that's pretty much all I have. Any questions?
No? We appreciate getting the updates.
Yeah.
Makes you not want to eat anywhere in town.
Only certain.
Yeah.
Right, Mike? That's the control.
Hello, myself and my guys, we attended the IVCA meeting here in Terre Haute this year. It was held at the convention center. Nice place, nice facility. It was March 18th and 19th. We learned a great deal. We finished up all of our maintenance on everything. We ordered our chemicals for the upcoming year. We began our tar amnesty program, and Mother Nature hasn't been cooperating too well with it. Between the rain and the cold temperatures, a little slow with the public bringing in tars, but we have filled 1 trailer, working on the second one. We sent out our letters to the tar retailers, reminding them of our tar storage ordinance that time of the year. Sent out our letters to the cemeteries, asking them for their cooperation, making sure that they empty the bases and that don't have anything in standing water. We sent in 2 batches for rabies testing, and both were negative for rabies, so that was good. Other than that, we're staying busy. We're getting ready for our season. We'll be doing tar amnesty all the way to May 3rd, and then we'll probably start running the alleys at that point, picking up what the public doesn't bring into us because they're out there and we know it, so we want to get them picked up and get them disposed of. Then we'll go into our catch basins and everything else. Anybody have any questions? All right, thank you.
Thank you for all your hard work.
Thank you.
Hello, everyone. Hi, Dr. Turner, if you can still hear us.
How are you?
Good, good. All right, so in front of you, you have my report. A lot of it's still the same. We do have Narcan on site now. I filled out the grant. There are other opportunities around the area that do have Narcan. But if you're looking at it this way, there's a lot of services that are provided in this building. If someone's walking in here, you cannot tell with the naked eye that they're coming in here specifically for Narcan, such as different areas where they may be able to easily tell that they're there for that reason. So we do have 20 doses currently. There should be more coming in. I just specifically wanted that before the eclipse. And we partnered with some local recovery centers here in the Wabash Valley. And they are really the boots on the ground getting out these non-syringe harm reduction kits. So that's why our numbers have increased tremendously. They've spiked. Pretty much monthly, I'll get a call saying they want some more, about 50 to 25 kits per each specific section. So they're really getting those out in our area. And then following along with the non-syringe harm reduction kits, I actually did a mini med session that's through IU School of Medicine. It was hosted at the Lansbaum Center last night. So that was really exciting. That was our demographic that we really want to try and educate on harm reduction. It's no different than putting a seatbelt on. It's no different from, putting an oven mitt on your hand before you grab that hot pan. So we're just trying to break down that barrier of what harm reduction looks like, so that way more people can come to it and get these services. And then the last mention that I have that's a little out of the ordinary is Johnson County Health Department. They actually got in contact with me because they have a new position through their HFI funding of a public health educator. So I was able to meet with her and kind of say what we do here, what some other counties do, and how she can be successful in her role.
It's been fun being big brothers and big sisters to the health departments that are smaller than us, whether it's helping them with, sharing ordinances that we have in place, like our body art, or what we do, because we've always been so lucky to be so involved, with that only deficit being social services, which now we're trying to pick up on.
Any questions? Thank you. How are you doing?
All right, nursing?
Well, see, we've had more animal bites than it seems like we've had lately. We've had our increase in giving TB tests, which usually always happens the first of the year. All the daycares and everyone else renewing all their tests. We've had a couple people from state come in, Gina, Amy, just normal meetings, catching up on everything. Finally hired a full-time RN. I do still have one full-time RN position open. We had a meeting with the school nurses to plan, instead of waiting and doing a back-to-school clinic, we're going to do an end-of-the-year vaccine clinic to try to catch them before they go on summer break. So to kind of try to bring them in, we're going to do a bike raffle, so they'll have a bike for summer. Let's see. Carolyn and I are going to attend the National Network of Public Health Institutes annual conference in May. That'll be in New Orleans. We've got lead testing coming up at Head Start. We're working on a couple clinics. We want to hit West Terre Haute over the summer, and then we're still going to do a back to school clinic, but hopefully there won't be as big a rush if we can get them at the end of the year. That's about where I'm at. Is there any questions?
Do you want to share with them the school liaisons?
Oh, yes. So we are going to bring on board a full-time school liaison to partner with the Vigo County School Corporation to kind of do more of like health education, is like hygiene kits, teaching girls how to use feminine products. Now I'm going to draw a complete blank on everything.
Focus with immunization clients. But she and Elaine Miller, which is the head nurse for the school corporation, identified gaps that aren't in the regular health and PE curriculum or being supplemented through their contract that they have with Union Hospital for health programs. So this is what we're going to do. Come July 1st, we've asked the council to fund it for half of the year, and then we'll write it into the 2025 budget. Now that's one of those shall in the HFI funds. We just have had a difficult time getting our foot in the door, going through the traditional route of PE and the health curriculum.
So what type of individual? I'm sorry, is it going to be a nurse?
At the lowest, I want a CMA, so they can at least give vaccines. We're going to be pretty picky since we'll work under our licenses, but the lowest will be a CMA.
What happened to our COVID cases? Any report on COVID cases? Is that completely out of the picture? Or?
It's not being tracked anymore because we're so busy. Everyone has home kits. There's really no way to do some sort of good estimate of what's in the communities. So hospitalizations are still being tracked by the state, and of course deaths are still out there and trickling in every so often, but we've been hospitalizations or death rates.
I noticed too in the report that you have no item for HPVs, sexually transmitted diseases. Is that not reportable anymore?
The state actually partnered with Positive Link, and they work out of Monroe County. So Monroe County works all of our STD and STI cases. Honestly, I can't even see them.
Certainly they collaborate back with you though to know.
Nope.
Do you still have that increase in HIV?
We haven't heard any more about that, but we did have a situation that has came about again that started in 2014 that led to a prosecution of an individual that was deliberately spreading HIV, got back out, we're back on that path again.
So they don't share any information about positive testing in the county?
No, they do all the contact tracing, all the treatment, everything.
Who's in charge of those?
Positive Link out of IU Bloomington.
They both, the State Department of Health created districts for STIs, HIV, and it's housed out of Monroe, where they're responsible in Lee County, and they have at least one DIS that works, disease intervention specialist that works the entire district. But we obviously are going to need some changes in Indiana with that, because there are numerous other factors that come into play, whether it's, healthy outcomes in pregnancies, all kinds of different things we don't really think about, but that's been a challenge, Mark. I mean, a big challenge.
I'm 0 for 2 with my questions. Number 3, certainly if there was a spike or a notable health concern, they would share with us, right?
They did when we saw the uptick of newly diagnosed HIV cases that were intravenously drug use related, and then they came to us
That was
with
about a year ago, right?
that about a year ago. And then, as I was stating, like in 2014, then that once that was identified as at least 5 people related to that individual, which I believe it ended up being 13, then that was handed to us too.
So it's been in play for a while.
Yeah.
It's not public reported anywhere.
Say again.
It's public reported.
That's what I was
Across the
thinking,
state.
by county.
So that's what,
or something.
Well, all health department, any laboratory, physician,
Right.
private doctor,
Right.
they all have to report the list of diseases that are on Indiana's communicable disease list. Except once it's reported, for that, whatever reason, that one doesn't, those things don't come into the local health department, they go into this contracted entity, Positive Link. For our district.
The reporting is archaic though, because you have to put it in 2 envelopes. I've been trying to get somebody to pass legislation to change that, make all that CR reporting consistent. But yeah, it's like some paper form, fill out 2 envelopes, one not labeled. I mean, it's bizarre. None of my docs I work with knew how to do it, so that was encouraging.
Even the record keeping, like the paper record keeping, they have what's called the vault at IDOH. And then they have what they call the cage at Monroe County, and it is just files, and you, like where one DIS may come in and she sees that this, her newly diagnosed person lists their contact, there's no way to really cross-reference them unless you dig through it and find the other paper files.
Positive work.
comfort.
Never positive.
No
No link either.
Yeah, the face of AIDS has changed so much. I mean, it
Yes.
can be undetectable, and it's the whole stigma thing and the discriminations against people of different lifestyles. I think it's archaic. We need to
Our
change
code
it.
is, and
Yeah.
decriminalize it. And obviously, a baseball bat's a baseball bat, you pick it up and hit someone with it, but they're those kind of rare and far between.
Right. Hey, I was just curious, the animal bites, like, is there some thing with that? Like, what's happening?
It's mostly
It's
me
joking.
and the eclipse. Total eclipse was
Just the
coming.
eclipse.
Everybody getting wound up, plus me.
No real theme, just dogs getting out, and a lot of people get bit by their own. And now, I don't know if the offices have just learned that they have to report them now, or if a lot of people just get bit by their own, they have to go in and have them cleaned and antibiotics, and then we get the report for them.
Convenient care, send you that.
There's no rabies rates at all, right? Zero.
No rabies right now.
Can we share this clinic information? Is this out?
Yes.
Thank you so much for all your work. Do we have any citizens input?
I'd
Oh,
like,
sorry, what did you say?
yes,
I do believe in that.
I just wanted to introduce Sasha Thompson. She's been with us from ISU this semester. You want to stand up and tell me a little bit about what you've been doing?
Yeah, I'm a senior at NU State this year, so my major is nutrition and wellness, so I'm on my last class for that to graduate, which is community nutrition. So I've been doing a lot of my stuff with the health department. I've done stuff with Shelby and with Amanda, and I'm going on a lead case on Friday. So yeah, I've been on a few food inspections. It's been fun.
And then thank you, Sasha. I'd like to introduce Autumn Finner, and she's a project manager with the Luger Center here in Terre Haute.
This was not scripted, thank you. Yeah, so I moved to Terre Haute in November, so I'm relatively new. Making the rounds, just trying to understand what's happening from a health perspective. I do work for the Luger Center, and one of the projects that I'm in charge of right now is our community health needs assessment. So actually understanding and assessing the overall health needs for our 9-county service area, and then coming up with an implementation plan to address those needs. So making the rounds, just trying to figure all of this out.
I know there's a document sent out on HFI, and I hadn't had a chance. I saw James has it. But can we just kind of talk about what's going on in HFI? And I hope to review it tomorrow. But
Absolutely.
I know you noted $240,000 of it spent.
So far, yes.
Right. Okay.
So I put together a work plan for our county health department, and it covers what the core public health services are and what our objectives and our strategies are. And what I did is I listed all the core services and what falls under the 60%, what falls under the 40%. And then I went through each one of those core services and I put whether we were fully strong, how we were performing them like strong, fully performing. And I laid out what our objectives are, what our strategies are, and who our current or potential partners can be. As I stated earlier, fortunately, we do almost everything. And in that document that I emailed you, it lays out the things that we need to work on and how we're going to work on them. Not very many, but it's still there. So what I've been working on, we're meeting tomorrow at 4 with the president of the council, one of the commissioners, Dr. Brucken, Jimmy, Amber, Mayor Sackbun, Todd Dackerfus, and Dr. Brucken and myself. We're going to look at what we've already identified as needs in 2025. I reached out to all of our currently contracted programs, accounted for them, for the programs. The stuff that we're doing with this county parks, and that's gonna be our 10%, along with the YWCA working with them. They'll get part of that 10%, that new equipment. But and what our health department needs are as far as funding the employees that are funded out of HFI. And then the rest will be divided up into programs that are assessed within the county. And one of the things that any funding that is appropriated is going to have to be understood that data has to be tracked. It's not like ARPA funds that you just hand it out and say, there you go, this was a good assessed need, there you go. Ours has to be, it has to fall under one of these core services, how it's gonna fall under, and how are you gonna measure it? Input, output, what are you gonna do? Is it gonna do what you say it's gonna do? So, and that's twice a year reporting. We are mandated to do that to the state legislature. So that's kind of where we are right now. Now, as far as what's been spent down, that's gone towards salaries, it's gone towards like the program with the courts, Parks Department, our tire amnesty program. I had to remind Brian Halleck that they had to put in any claims in, and we were, into the second quarter now of the year. So, and I know they got some ARPA funds, so maybe that'll just kickstart them into claiming their funding. But it's moving right along. Robin and I had a Zoom call last week with the regional finance coordinator, and she said some of the counties are like, yeah, we spent $5. I'm like, no, we're right on, the money as far as what we're doing.
The tire amnesty program, so we spent the HFI money on that because we had already had that program in place, right?
We did. We funded it out of our trust fund, and so as of July 1st last year, the trust fund and local health maintenance no longer. Yes, we still have to, so those funds, so anything that we had identified that were funded by them, then morphed into HFI. And then what was remaining as far as carryover, which is what you see on here, we had to come up with other ways to then come back and say, because the state didn't tell us until January, what to do with those leftover funds. And so that's where we're asking for an additional peer coordinator, a school liaison to come into play come July 1st to be funded by it. And then part of it will fund the program with Chances for Youth and the courts. And then that'll wipe out those two accounts. They'll never exist anymore. And then the programs that we had funded underneath them will continue. So that was a trust fund program. So like our health educator position, it was always paid, and an environmentalist paid out of local health maintenance. They're now paid out of HFI.
We still have contact, do we have a lot of contact with the regional guy that
All
his name's Mike?
All the time.
Okay. Does he do your data?
No, we actually have a data person.
Oh, you do?
And the state just introduced in mid-February what the data tracker looks like, but it's really not up to snuff yet because so many of the core services are crossovers. So if you're saying, you know, you shall do tobacco programming and you shall have a school coordinator, liaison, you know, and so let's say you're a county that does have a school liaison that does the tobacco programming, well, you can only count it as one so far. So it's still evolving. They have a person specific for it. We have a regional district meeting, a District 7 meeting next week over in Clay County. So all the county health departments that are in District 7 will be there. And they pick a topic under HFI, and it'll be trauma and prevention. And Molly's going to present on, her and Shelby are going, Molly's going to present on what Social Services Division is doing. But yes, we hear from Mike just about every day. Mike's up.
Please.
The evaluator, so that person's in place, they're just waiting on to know what to look at, right?
Right.
Okay.
Yes.
Are you paying for it through, can you pay for it from those funds, the same funds, HFI funds?
No, I will enter the data into their data, the state's data tracker, and they do the analysis.
The state does? Oh, we don't as a county have one?
No.
Oh, okay, gotcha.
And another thing they haven't worked out yet is, you know, there's the maternal health component, but we don't do the maternal health. You know, they would come up with all these surveys, and this has been one of our little grumps as administrators. And you'd have to say which of the KPIs, core services you were doing. And we would say, okay, we have all these things in place. You know, we do car seat safety checks. We do in Vigo County, but they're not the health department that's doing it. We just have to make sure those programs are in place and you know, there's that collaborative piece, which there is. And so how do I do I go to the Lugar Center and I say, okay, I need your data. Do I go around to each one of the entities that implement these, the programs that we don't do, but are identified as being done? So that's another thing, like how do we do it?
When Dr. Weaver was in here in the fall, when we were talking about it, we had good representation from the community. So are those folks and those key leaders still at the table helping assess?
Yes.
Okay.
Yes.
And with that, do you feel confident that they're big and bold coming out of this? 1.5 million? I know that was kind of the theme that day. Let's be, you know,
It is the theme, but Mark, when you know, all of these things that were identified as core services, the KPIs, they are spot on.
Okay.
But 1 month after, less than 1 month after it was signed by the governor, HFI, the IU Fairbanks School of Public Health released their public health workforce study on Indiana. We don't have the workers and we don't pay the ones we do have enough. And so I said in our Zoom meetings, what other county health department, what other county councils appropriated stipends to augment the salaries of those that are already there? Because our council doesn't want to, you know, say, here, that now is part of your salary and then the funding go away. So ours is as a stipend. Oh, no, they don't want to do that. I mean, if they give the health department a raise, they have to give the highway department a raise. Okay, that's not what this is for. And I mean, that's the way of thinking. So I really think there needs to be more advocacy from the state to the county councils, not just, you know, because our commissioners understand that once they opted in, then they're out of the picture and then it just goes up to your fiscal body to decide how it's used. But that's where Mandy was saying about the lead training. It's a mandatory thing to have a licensed risk assessor in every county, but they don't have anybody to do the training. And then you have to find employees somebody that you can employ that would be able to pass that certification, because it's very difficult. So yes, this funding could help, but if we had the employees to implement, that's gonna be the biggest challenge.
We have to have
A reason for someone to come and do it, is what you're saying, right? So maybe lead a current position.
But we had a huge exodus out of it after COVID. And then if you are saying to a public health nurse that has to be a registered nurse, I'm only gonna pay you $44,000, $45,000. Oh, come on now, seriously. And that's where it comes into play, is how do you get the qualified people that you need and try to retain them? And I'd like to see some of this used towards the schools that have public health, community health programs, to try to offer Health First Indiana scholarships and say, work in a public health department for 5 years and we'll fund your tuition, something along those, some type of incentives. But we definitely need the employees in Indiana, and I don't even know how the smaller health departments do it, because we struggle with finding a registered nurse. But it was a huge positive to see it with the bipartisan support, because there is that recognition that we've got to do something better here.
And that's just where my mind is. 2 years down the road, are we still gonna have that support if the data that you're entering in this tool isn't demonstrating? So I feel like this is an opportunity.
And then when you look at it, the data, it's looking at have we moved the needle at all? Because we know it's gonna be a slow process. Now, a meeting that Jimmy and Dr. Bruckman and I sat in last August, Chris Schweitzer was there, and he had talked about being part of the advocation at the State House for enhanced public health funding. And he felt certain that this funding will continue after 2 years, even if, when the governor changes. And if anything, even if it's seed money to see us grow, and then to show the justification as to why the funding needs to continue.
Does that have to come from the county level too, like it's starting to? Is that the idea? And then it comes from the state, but also like when county gets extra funds and just, yeah. The support, I should say probably support. It's gotta have county support too.
Yes.
Not just state.
Right,
mandated
yes,
support.
yes, which I think what you're referencing is, by state code, the local fiscal body has to create a levy to support the local health department. It's a shout, can't get out of it. But that's the thing to look at, because in the past, traditionally, the county councils, we don't have juice, we don't have any political connection, we're non-political, and we tended to get overlooked. And that's been a big change in mindset over the last few years that's been so positive to see the involvement and the understanding of where health and education fit into prosperity, economic prosperity.
This might be way out there, but come to Mark's point, have you thought about having some type of statistician that would work just the data from this area? Because I see it as an amazing opportunity to any project that I've worked on. If you have some seed money to get something started, and you have pre-data, and then you throw all these different things that you guys are doing amazing things at it, and then we can show post data, then even if down the road, 5-10 years from now, you don't get funding from the state, you'll be able to go wherever you want to get funding. So I wonder, I know that they're sending all this stuff to the state, but if we had our own data here, like we have awesome 2023 data, that's why to work it going forward with all this extra money, we could keep grant funded for years after that.
And I don't know, I don't see that position under our umbrella. I could see perhaps the Lugar Center doing it, because they are always tasked with doing the 5-year assessment for Union, or the chamber because of their, and Josh will be at our meeting tomorrow out of the chamber. But I could see something like that where they could pull together and I know that's one of Brandon Sackbug's goals. That's why they put together their site. But that's something we can talk about tomorrow night. Could we have a county statistician that works with the city, works with the county, works with all the entities to gather that data? because there's everything splintered.
Yeah, a lot of it's gonna come from audit, needs assessment that audit.
Yes.
Or can we partner with ISU or somebody to help?
Sciences department.
Right,
Yes.
right, to help it.
And they need to publish.
Yeah, right.
Let's bring that to the table tomorrow.
That's what I thought, I guess, at first, when you started talking about that, I didn't realize that you put it all in, yeah. I was thinking you had an outside person that was gonna start doing that.
No, but in retrospect, that's probably something that even if within the district level, if they had put a position in place, because it's not gonna, you're gonna have the same core services that you've gotta look at for each county, but that would have been a great position to have added to look at, did we move the needle within the districts and then within the counties? But in retrospect, yes, that's something we could have added or should have added, just was not placed under our radar or really any of the county health department's radar.
But it's, like you said, kind of joint between the city and the county, that's interesting to think of.
Any other discussion? A motion to adjourn?
Thanks, everyone.
Here we go. Oh, wait, Jennifer, a second.
Second.
Okay, all those in favor?
Aye.
Aye. Any opposed? Thank you.
Thanks, everybody. I'll see you in July. Thank you.
We have to hang off.
Bye, Dr. Turner.
Yeah.
Where's the girl?
Mark, the department, actually.